Well, thank you, Joe, and I wanted to
Thank
take
you,
this time to
Ron.
open up the Q&A to the audience.
From what you've said, I probably know the answer, but I'm curious anyway.
Sure.
Do you interpret your work for yourself?
I usually don't.
You don't.
I've started to recently. I think that's okay. I know there, historically there've been fear in some artists to really over-interpret their work, that somehow they may lose something in the creative process. But I don't think so. I've started to interpret it more, and it's actually adding to my understanding of how I create and what I do. It hasn't detracted in any way, but I know I've heard some artists talk about that and get anxious about analyzing it too much.
Well, I'm
But I have
asking
started to.
particularly because you're a psychiatrist
Yeah.
as well, right? So you seem to think that things are unrelated, where as a Jungian, I think they're terribly related.
No, I think they're very related. I think,
Oh.
again, I've seen it so much as an oasis. I guess
For
maybe it's so
yourself.
personalized for me.
Uh-huh.
I've seen it so much as an oasis to go to for myself and to give myself a lot of balance in my life, that perhaps maybe I wasn't as willing as I am now to interpret it, to kind of just let it be and enjoy it. I mean, I've even resisted the idea of formally schooling myself. I really, it's very private, I guess. I've kept it very much to myself.
You
I'm
want it to
opening
be
it up more. I mean, I
diminished.
didn't even share it. I didn't even put it in shows or anything. So over the past couple of years, that's been opening it up for me. But that was kind of my way for a while.
Did you talk about it in terms of the dark side of nature? Was that a result of seeing what you had done, or was that kind of a concept you had?
It was kind of a natural outgrowth of what I've been interested in, I think. As a kid, I would very much kind of take a lot of long walks and be very reflective and very much in my head, and would take long walks in the woods. And I was always very intrigued with, I guess, not the typical versions of what we would say beauty is, or symmetry and stuff like that. I would be more interested in the gnarled roots and the moss growing in the rocks and the dark crevices, and those are much more interesting to me. And I know in my work I always look to find those areas, and I like them, I enjoy them. So I felt that the title, Dark Side of Nature, as a show really is literal, dark, just the word dark and the dark spaces in nature. How nature, although we think maybe mossy areas and rotted down buildings and stuff like that may be dark in nature, I found that very interesting. But they also kind of represent parts of our psyches that we may call dark, but I think are endlessly fascinating.
Yeah, that's why I was
Yeah.
just struck by the word dark, because that carries with it a certain connotation.
Right.
And I was thinking, this just feels like part of life, part of
Right.
the psyche, whatever, light or dark. Yeah.
True, true.
I was intrigued by that. Yeah.
I don't know if I'm lending something to, bringing something to this that isn't there, but to me, there's, I see a huge metaphorical sort of frame for this. It's as though you're taking the analyst or psychiatrist's work and making it real in front of us. In other words, the materials you pick are unforgiven. They're as they are, the way a patient is when they come in. You're not just creating it because of a feel on the canvas. I mean, you're taking what is there and maybe changing the arrangement a bit, but not changing its nature at all. And there's a careful frame in your pictures that is like the frame we deal with, that has to be there and creates something just by its existence. And I mean, all of these, dark though they may be, invite you in. There's a feeling of, if you go in there, you may go through there to find the light. There are open spaces. There are places you kind of see yourself hiding behind or going into or walking through or something. So I think to me, there's a real parallel to the work that you do.
It's a great point. Thank you.
Yeah.
I'll remember that.
Yeah, I'm just curious, you mentioned a couple of times about balance, and you were talking about a little bit about the function, mental functions.
Yeah.
And when you're in an artistic place, it's a very different mental function than when you're in another place. Just looking at one picture there called Overwhelmed, I mean, I think, and I just, you know, if you could speak to the cultural implication of that. There's a head, it's oversized, yeah, it's oversized, the body is shrunken, okay? And, I mean, there's clearly something speaking to, you know, a mental process occurring at this time, which is, I think, pretty limiting, okay? That I would call kind of like highly mental or rational.
Right.
So, are you?
It directly speaks of an experience when I was in residency training in psychiatry. And as literal as it is, I was feeling pretty overwhelmed. And it also kind of dug into my interest in anatomy. I mean, it was one of the courses I really loved in medical school. So I decided to get really anatomical in that drawing, but also show the figure kind of being pulled apart in so many different directions and being overwhelmed. And it was just a statement on my own inner state that I was, you know, experience that I was going through for quite a while in residency training.
But to dovetail with
Yeah.
what John said, I whispered to him before, they look kind of postmodern, don't they? I mean, it has that, I mean, that one in particular, right, I mean, my interpretation on it, right, is an over-reliance on the head, the mind space. And it seems like postmodernity has kind of wrung out any sense of spirit or meaning and mocked it. And so that I guess I was wondering and looking at it if that was something you were, you know, contemplating or reflecting on in your work or after you produce a piece like that.
That piece again, yes, I was, I guess, feeling like a rag wrung out, just in the educational process itself, because I forgot who, I think we were talking earlier about how the training in residency training and in medical school can feel very militaristic and can feel very controlling, and in a way, there wasn't that sense of freedom that I felt at that time. I felt very constricted, very controlled, and for me, that's overwhelming to feel that way. So that was, again, a reflection of what I was going through at that
Like
time.
overwhelming to the spirit.
Yeah, exactly.
You
To
keep
the
reviving
spirit.
in your artwork.
Exactly.
Or reconnecting with or something.
It felt too controlled and too just mental.
Yeah.
I guess, yeah.
Yeah.
When I look at your work, as I look at most art, but I see so much of something I don't know if you've seen, because the psyche to me is a landscape, obviously. And there's a wonderful combination in your work of both wild and ordered, but older, and seasoned, and weathered. And so, and there's this wonderful random chaos in it that I find incredibly attractive, that draws me in. So I think about these wonderful pieces of yours as your landscape of your psyche, but also just this great balance of wild and weathered. And so it's a beautiful, I just wanted to say that, just a beautiful portrayal of something that it's almost like a dreamscape. These are magnificent pieces, so I just wanted to say that.
Thank you very much.
I mean, I don't know how.
Maybe Eros and Thanatos?
Something
Yeah, I heard a therapist, he gave a talk once, and he had been a painter before he became a therapist. And he talked about how the patients, he viewed them sort of as a canvas sometimes, and he would approach the treatment as, you know, where did the extra color have to go, and the shading. And it sounds very different from what you were saying about, you seem to, you've got the right brain and the left brain, and the two don't seem to. I'm just curious. I couldn't tell if he was being grandiose. You know, that he's got this work of art.
I think maybe when I separate it like that, again, it's probably for personal, more therapeutic reasons for myself. But I think maybe out of my own awareness, and the more we talk about it, I realize that it probably does trickle in more into my approach when I work with patients, because I do tend to start off with a holistic kind of gestalt type of feeling about the person, kind of get a sense, like you're saying, as an open canvas, as to where I see, you know, the concerns are, the needs, the drives, the motivations, and see where I can help in other areas that seem to be okay. I kind of see it that way. It's interesting. So I think it finds its way in, regardless.